Hi everybody, and welcome to another edition of Rice and Beans Doctors. And as you can tell from all those delicious treats and that stock footage at the beginning of the video, yes, you don't want me to do it, but I'm gonna do it. I got to be a good doctor and tell you the truth. Okay, today we're gonna talk about diabetes. What is diabetes? How do we get diabetes? How do you know if you have diabetes, and what to do once you have diabetes? I know, we're gonna bag on sugary treats, but it has to be done. Okay, let's begin. We've all heard about diabetes. We all have an uncle that has diabetes. We all have that auntie that has problems with her sugars. What is it? Well, once you eat, let's picture digestion, okay? You're eating meat, you're eating protein, you're eating carbs, sugary food, bread, cupcakes, cookies. You're getting hungry. I saw that video too at the beginning, so, I feel your pain. Okay, so here's what happens. Your body is breaking down those starchy foods into simpler sugars, and at the end of the day, the end product is this right here. The mighty glucose, the sugar. How does the body process the sugar? It's very simple. Just picture this. Picture a car going into a garage at your home. You need something to get that car into the garage. Well, what is it? Exactly. Click. You need that clicker to open that garage. So sugar, visualize sugar as a car. It's running down the street. It wants to get in the muscle. It wants to get into the cells. It wants to feed the tissues. What does it need? That insulin clicker. In a perfect world, this works 100% of the times. But in a disease state like diabetes, in a disease state, here is what happens. The body gets sensitized, or the insulin is less effective at its job of putting glucose inside the cells. Maybe it has a little to do with all those cupcakes, all those cookies, and all that delicious food that you're putting in there. Insulin is simply not working as it should. So what happens? All that sugar stays roaming around in your circulatory system, wreaking havoc. And that's diabetes. That's type 2 diabetes, guys. It's caused by our eating habits, our genetic factors, and our environment, our food environment, that is. There's another type of diabetes, which is type 1 diabetes, or juvenile diabetes, that your pancreas is simply not producing enough insulin. So there's not enough clickers to put the cars inside the garages. You get what I'm saying. Okay, when should we get tested for diabetes? It's very simple. At 35 years of age, all of us need to get that big yearly exam that contains cholesterol test, sugar test. That's a good starting point. But if you have a strong genetic predisposition, if you have some extra pounds on you, you might want to be tested earlier. So ask your doctor about testing. We do fasting blood glucose, and we use glycosylated hemoglobin to make the diagnosis. So don't get discouraged. This does not mean that you cannot enjoy good sugary treats, great food truck food, great, you know what, I'm getting hungry. But what does this mean? Do it in portions that are controlled. You don't want to overdo it. Everything that's overdone is always bad. So I'm going to cut this video right here, because if we go too long, we get video diabetes. That's a bad joke. Damn. All right, guys, so we're going to have more in-depth videos in March. This is our month, our diabetes month here at Rice and Beans Doctors. Thank you for your attention. Keep watching our content. Mwah.